final panel of the day has already assembled, and our final panel has the easy task of kind of summing it all up. Where are we and where are we going? Our three speakers are Andy Thane, who's the founder and CEO of At Home Care, Beth Sweden, the executive director of the DD Council, and Helen Marks-Dix, who I understand is the AARP, Association State Director of Advocacy, and has been described as the final Hellraiser of the day, which probably is a very good title to have. Andy's advanced man just came up and visited with me a few minutes ago. That would be Lynn Breedlove, who told me that Andy has quite the record of deciding what he wanted, where he wanted to go to school, what he wanted to create, and how to get everyone the hell out of his way so he could get it done. And apparently, your PR director, who I understand does not have an official retainer with you, but certainly
he does.
Well, we're glad that he performs these tasks without remuneration. We just don't want the managed care companies to look at him as a model for that. But anyway, Andy, we'd like you to go first, and I hope your PR is as good as your delivery. So.
Yeah,
thank you.
No pressure, right?
No pressure at all.
All right. Well, thank you, everyone, for inviting me to come up and talk to you today. I want to start by going way back in time to 2003, 2004. That was the year that I was accepted to Marquette University, and 2004 was my freshman year. I went into Marquette after a business administration degree, and when I got there, I realized that not only was I charged, by the way, can everybody hear me?
Yeah.
Yeah.
Okay, good. Not only was I charged with getting a high quality education, but I also had to manage my disability, which was something that I didn't realize was going to be quite as big of a challenge as it was. And one of the things that I had at a very early on in my college career, I had to retain people to help with personal cares. And as you guys have all heard, personal cares are things like getting out of bed, getting ready for class, getting back in bed, and everything in between. And we tried to do that with a traditional home care agency based in Milwaukee. I won't mention their name because it didn't go well. And what I ended up doing as a freshman was kind of building my own home care agency from scratch. I hired a couple of college students, a few nursing students, a few PT students, and I kind of built this core group of 3 or 4 or 5 people, which really were key to seeing me through my 4 years of college. After graduating in 2008, I went on and did what every other college student does, and I tried to find work. And that didn't go very well either. And so what I ended up doing 2 or 3 years later was I founded At Home Care. And At Home Care is a Medicaid certified personal care agency that covers a 4-county area. And we have roughly 100 employees, and we are serving roughly the same amount of people. And I am told, I don't know if this is true, but I'm told we're one of the biggest employers in Clark County, next to Grassland and a couple other really large companies. So we've grown rapidly. We've been doing this for 4 years, and it's been quite a ride. It puts me in an interesting position because I'm on both sides of the fence. Literally, I am receiving long-term care supports, and I am also setting them up and managing them for a whole diverse group of clients that we have contracts with, I believe, 4 managed care organizations. We work off of the old fee-for-service model. We work off of the Taylor County legacy waiver. And so I have a really broad kind of understanding of both sides of the fence. And so that's why I earned the privilege of coming to talk to you today. I wanted to talk specifically about a few things that I think are relevant, and you can forgive my notes as it's been a long day. But I wanted to talk quite a bit about exactly what long-term care means for not only me, but the people we work with. I've seen situations where people can get by in their homes for 1 or 2 hours a month. And I think that's a tremendous achievement when we talk about the cost of long-term care and the thousands of dollars that could be spent on a nursing home for somebody that could literally get by.
It's a flu, bug or something.
Oh.
There, sorry.
Well, that's all right. So anyway, when we talk about the cost and really the value that we're getting out of our current long-term care program, we're talking about, in some cases, maybe $100 a month that these people are spending in tax dollars. And with that, they really get us an astounding amount of flexibility and independence. They get to live in their own home, and in some cases, they're really involved in the communities. They're able to go to their own doctor's appointments and really be their own advocates. And I think from what I've heard today, that's really been a theme of self-advocacy. I know Jessica talked a lot about that. I've met Jessica before. She really summed that piece up better than I could have. So I think that that's an important part. But I also want to recognize that even situations for someone like me, who is going to require more than just a couple hours a day of personal care services, it might be between 4 and 6 hours a day. One of the very first, in fact, the first client at home care ever took was an old family friend, and I won't go into the specifics, but I sat down with them when we were started, and they kind of went through with me because he had Parkinson's, and they were looking at long-term care options for him. And they had done all the math and laid it out for me, and they had said that as long as we could keep him in his own home and provide between 8 and 10 hours of service a day, that it would be a bargain compared to assisted living. And they wanted to keep him home, and that was what he was really focused on. But just fiscally, from the financial side, it made financial sense as long as we could keep him safe at his home for less than 8 hours a day. And so when we talk about people that are requiring 2 or 3 hours of service a day, these people are able to live the lives they want, and the taxpayers are really getting a deal. And so I think that's an important point to make. I want to wrap this up, but I also want to talk about the things that our agency has done on the front of making things more efficient and quality assurance. We're in the process of rolling out electronic filing and also electronic visit verification. These are all things that are going to allow us to be more competitive, have a better handle on our quality control. And so we're seeing a lot of movement in our industry that recognizes the importance of streamlining things that would previously bog us down. And I'm really excited about the opportunities there because, and I know this was asked of a previous panel, we do have difficulty attracting and retaining staff. And so anything we can do to streamline our administrative costs and put more money in our employees' pockets is something we're very much focused on. And I think that that's going to be key to success of our agency in the future. And with that, I will turn it over to Beth. You, Beth.
Thank you.
And I don't think Andy under-delivers at all. So from there, I want to thank you for letting me speak. Thank you for coming to Wisconsin, members of the council. I'm the director of the Board for People with Developmental Disabilities, Wisconsin's DD Council. And our 26 board members are people with developmental disabilities, their family members, and representatives from state agencies. You already met Patrick Young. He's our board chair, who gave that great employment presentation. So that gives you an idea of the stellar nature of the group that I serve. So our board members' experiences from all over the state, and what you've heard from our self-advocates today across the state, is the message that we're getting from hundreds in the disability community in the past few months as Wisconsin looks at moving into a new long-term care managed care model. And that's that no one is more committed to the sustainability and the responsible use of Medicaid long-term care than its participants and their families. And the disability community has many recommendations for cost savings and quality improvements as we move ahead as a state. So that's a little bit about where I want to park in my comments right now. One example is our IRIS program. Our IRIS, 12,000 IRIS participants that Mitch and others talked about, who are currently self-directing, are a perfect example of innovation in our states. And they give back 17 cents on every dollar that's allocated in their budgets. How do they do that? Well, they're finding more cost-effective ways to pay for their care. And from a purely practical perspective, and I am a parent of a young adult who uses long-term care, anyone who's had a series of providers in a revolving door through their homes knows that they'd rather minimize their reliance on paid supports whenever possible and just go ahead and live their lives. As we've heard from our participants today, Wisconsin's long-term care programs are so much more than health care. They're the important supports that allow people to find and keep a job. It's a set of relationships and resources that allow participants to contribute in their communities, and it's the relationships they've built that ensures more than 50,000 Wisconsin residents with care needs are safe in their homes and as they navigate through their communities. So the quality of long-term care in Wisconsin is often that linchpin that's actually determining people's quality of life. So for a few ideas as we move forward, first of all, we want to recommend continuing a robust self-directed option that allows all long-term care participants, no matter how significant their disability, to fully self-direct, manage their own budgets, hire their own workers, and set their own wages. The IRIS program has demonstrated in just a few years that individuals and their support networks can build creative solutions to providing high-quality care while saving money and leading to better health outcomes. Often it's the individuals with the most complex disabilities who are finding the most creative solutions. And our quality data in Wisconsin, as measured by the National Core Indicators, currently puts us at a higher quality of life than average in most categories for our IRIS participants, particularly around issues of choice and health promotion. IRIS participants were 20 percentage points more likely than the national average to have chosen their own care coordination, and nearly 15 percentage points more likely to engage in regular exercise. They also were more likely than the national average to get regular physicals and dental checks. Just as important, IRIS participants report they have the flexibility to find creative solutions and hire the right people to prevent many of the costly institutional placement and reduce their hospitalizations, which again is another big expense. So that flexibility and creativity needs to be preserved for all long-term care participants in our state. Next, as you heard with the panel that just presented, prioritizing integrated individualized employment is going to maximize people's financial independence in long-term care, and it also builds on the ABLE Act's ability to save for expenses. We want to talk a little bit about the managed care providers themselves and what they can do to really invest in employment support. As Ari mentioned in his early remarks, that contract language is really important. We don't have any benchmarks set up in our current MCO contracts, and we need language that has definite movement towards improvement. And as the panel said before, we also need to really invest in provider capacity to change the model in our state. So those are things that will be really important. I was going to spend a lot of time bragging about Dane County and their outcomes, but I thought Doug Hunt did a great job of that, so I'm not going to go on with that. Other than to say that some of their programs like Partners in Business that put the job coach right in that business as somebody in the business themselves rather than a paid provider, it works really well. We do that in our office, and our office manager actually knows our business practices better than a job coach would, so it works really well. So again, looking for those innovative strategies is really important. You all know how important transportation is. For us at the board, it's the number one thing we hear about. And even really creative people like Andy and Patrick and Jessica have challenges with that. So we need to update and increase flexible transportation options in long-term care. We need to do things like allowing people to use Uber, local cabs, paying a friend, reimbursing for gas, some of the things that we do in IRIS now, but even expanding on that more. And let's have some pay-for-performance expectations with things like NEMT and other transportation support so that if people aren't delivering on those rides, they don't get paid. Another area with huge potential for innovation and cost savings is technology. Our long-term care programs need to encourage the use of current devices. We all have iPhones and iPads. I heard them ding out there in the audience today. We have dozens of apps out there. Things that used to cost in the assistive tech magazines $300 or $400 are now a $3.99 app. So we need to be using those. Specific sound detection systems, we have some called Night Owl and Sound Response in Wisconsin, allow people now to stay at home safely overnight, and then they don't have to be relying on attendant care when they're sleeping. Technology has so much to offer, and we really need to use that to increase people's independence and at the same time save a lot of money. Also, increasing the capacity of managed care organizations to respond to individuals who have both behavioral health and developmental disabilities. UW-Madison's Wasteman Center Family Ties program has developed individualized behavior plans that can be used across community settings for people who have developmental disabilities and challenging behaviors. Their efforts have been shown to reduce those costly emergency detentions that Brian Schaup talked about this morning and allow people to have experience success across a variety of community settings, both at home, at the job, and in the community. Another idea, requiring training on supported decision-making, which is a new way for family and friends to support people and avoid costly guardianships that render people incapacitated. This approach allows people to use their trusted friends and family members and professionals to help them understand the choices that they need to make and make informed choices. When staff are trained in managed care on how to facilitate supported decision-making, people are enabled to make their own decisions more often. And finally, let's include people in institutional settings in managed care at the capitated rate, rather than allowing for the carve-outs like what was allowed by CMS in Kansas. Including this population in managed care maximizes the ability of managed care framework to enhance quality and control costs. Wisconsin has been highly successful in reducing overall reliance on facilities in long-term care. Through the expansion of family care and IRIS, in the last decade, we have gone from 8.8 million nursing home beds a year to 5.7 million, a 35% reduction that's saved us $300 million per year. Our numbers in our state DD centers has also gone down, and we don't want to inadvertently reverse that trend by creating incentives for moving people with complex needs out of managed care and into costly institutional placements. In Wisconsin, we have a rich 20-year history of creating thoughtful, individualized, person-centered, and outcome-based long-term care solutions that have increased meaningful participation for people who rely on long-term care while reducing our wait lists and keeping people safe and connected in their homes. We know that with full participation by the disability and aging communities, we can continue to build on that system that can both better support people's lives and result in big cost savings into the future. So let me end with Olivia's story, and I do have Olivia and her mom's permission to share. Olivia is a young woman who faced early challenges, both with developmental disabilities and some pretty significant mental health issues. She was told in school that she'd always need sheltered employment and that she'd always need group living, and she did try 2 very expensive and very unsuccessful group homes before she enrolled in IRIS. She began managing her own supports with her family's help. She got her own apartment. She hired people she knew that she was familiar with and who understood her. And then she went through Project Search, an employment preparation program that resulted in a nearly full-time job at a major hospital. She began using her iPhone to plan her schedule and alert her with alarms when she needed to start a shift or take a break, and that reduced the amount of time that people needed to support her in person. Now, as she's approaching age 25, she and her family are exploring things like senior taxi services and church ride programs so that she can have even more flexible transportation solutions. As Olivia's success has increased, she's begun speaking statewide as a self-advocate about her employment and her Special Olympics experiences. Last month, she went to the Special Olympics International Games in Los Angeles, where she won gold and also gained international attention through an ESPN feature story. As her independence and confidence has increased, her overall long-term healthcare costs have gone down. Olivia's story can be Wisconsin's story of innovative long-term care success. Wisconsin's disability and aging communities stand ready to work with our managed care programs and with our Department of Health Services to design and deliver an improved long-term support system that honors self-direction, maximizes independence, and leads to sustainable programs that don't just integrate healthcare, but support meaningful lives.
All right, Helen, live up to that reputation.
Well, I get to be the political person today in the sense of saying where we go from here in a realistic way. You know, we've spent all day talking about great ideas and stealing ideas from others. And I always love to hear Brian talk about how wonderful Wisconsin is and what a great system we have, and then watch him turn around and try to blow it up. Right. So we have to actually come up with some concrete plans walking out of here today. And I'm full of ideas and suggestions. One thing I want to talk about is the fact that we talked about a lot about disabilities today, and our one representative up here was Donna today on behalf of the aging folks. I remember a time in aging and disability advocacy where we used to argue with each other over slots and where the money was going to go. And one of the strengths of Wisconsin is that the aging and disability communities and the aging and disability programs have become merged. And it gives us a strength that nobody was anticipating this year when they actually put into the budget, blowing up the system, not deliberately, no stakeholder input, just doing it. And I think they were very surprised both with the response that they got that was organized and the response that they got that was totally spontaneous out of groups of people that were just mad. And we were probably the surprise of this whole budget session. And the fact that we all walked away from it heartbroken, of course, because we didn't get 100% of what we wanted, but a little surprised that we actually got as much as we did, including this opportunity going forward to have more stakeholder input. Now, you all know, if you're as cynical as I am, that some of this input is going to be truly symbolic. And so it is up to us to make sure that it is not symbolic. So we have a whole bunch of strengths going into this attempt to influence what happens next. One is we have a good existing system. So when Brian talks about having that blank piece of paper and we're starting from nowhere, no, we're not. We're going to start by putting on that blank piece of paper all the strengths of the programs we currently have. And then we're going to put additional things on that paper based on our own experiences, our own looking at how we think the system can be improved, stealing ideas from other states that have done innovative things that we're interested in. And so we are not just going to walk away from that. We have experience in designing a system. What nobody talks about, or a lot of people don't talk about, is the fact that family care was designed by people in the Aging and Disability Network. We didn't sit around waiting for some package to be given to us by CMS or some other group. We actually did it here in Wisconsin. We created a good system once. Let's take our skills and create a great system the second time around. We have advocacy experience. You know, over this last 6 months, we have built up relationships with a lot of legislators. The whole question of legislative oversight and not paying attention to us is something that is historical and no longer accurate. I was pleased to see the number of legislators that were here today or staff that was here today. So we know how to do that. And so one of the things we have to do is not let the department run away, hide somewhere, make this package in a back room, and then present it to us and tell us how wonderful it is, and present it to the legislators saying, oh, we had 8 little hearings and we let them come and say a few words. Not our style, not the way we've done things, and there's no reason to change that. We also have momentum on our side. I think that people watching us over the last 6 months have wondered what we're going to do and how much we're going to tolerate. And, you know, we got our motion, the first motion we got through on long-term care wasn't what we wanted. We went back in and got more in the famous 999 motion. You know, we'll come back and we'll use all these hearings. One of the things we have learned, we've learned a whole bunch of things. One is the power of our stories. We've had wonderful people that have been willing to come forward and talk to their legislators, but also to talk to the press. And we just definitely have the emotional impact on our side. But along with that emotional impact, we have to have some really specific recommendations. And I'm hoping that's what today gave us and is going to give us walking away from here. If it was up to me, we'd all sit somewhere and take the best of the brains in this room and create our own waiver and our own system and our own vision of where we wanted this to be, and then come up with a competing plan. I'm willing to go against Kitty and Brian in the legislative arena any day of the week. I think we outnumber them, we outsmart them, we have better connections, we have better stories. So we could do that if we really wanted to. I think I think our big challenge is to keep the coalition going, to keep us all marching in the same general direction, and to keep playing to our strengths. So, we're going to have a series of challenges ahead of us. The first one is going to be these wonderful 8 hearings, wherever they may be. And I noticed they're billed as listening sessions rather than public hearings. The difference, of course, being they think we listen and they speak. I think that it should be we speak and they listen. We will then have a presentation on September 30th where they have to report in to the Joint Finance Committee about stakeholder input. We will be there to tell them that it was not adequate. And that, we will look and see what they present to us and then turn around and present it to Joint Finance totally unchanged if they are consistent with their past behavior. We will then go ahead and say that's just not acceptable to us. We have to continue, the individual legislators actually took a lot of credit for making the changes and ended up being pretty invested. And I think they want to continue the oversight, and we need to give them that opportunity by making sure we keep them informed, that we give them talking points, that we give them actually alternatives to what the department is going to do, tell them where we support. We just can't be the people of no, but where we support what the department's doing and where we have better suggestions that we want to see implemented. We can do it. I mean, we did a lot more than anybody thought we could do in the budget, so we do this step by step. If by any chance it escapes us and we get defeated at the joint finance level, at the hearing level, it's got to go to CMS, and that's a whole nother round of fights for us. Public comment period is a whole nother round of input we can have. So that our biggest challenge is not to get tired and to keep on going and to keep on getting the stories, keep on making the phone calls, keep on getting people out there, because we're much stronger than I think we realized when we started this, and I think we get stronger every day. And we have a reputation as being one of the only groups that went out there in the budget fights and actually made a difference. And we can't rest on our laurels. So, I'm supposed to stir the pot and get you awake at the end of the day. I'm giving you homework assignments. This is not going to end today. It's not going to end September 30th. It's not going to end April when they think they're sending this concept waiver off into the universe. It's going to end when we think we finally have a plan and an idea that we want to invest in and move forward with.
Wow. Wow. You live up to your reputation, lady. Can we take you around the country? I mean, you got some colleagues that can learn from you. My question, though, is with regards to CMS, how how confident are you that CMS will not be pro forma with you? And what efforts will you engage in to enliven your congressional delegation to help communicate with CMS? Just as an aside, we have traveled the country trying to awaken responsiveness at CMS. And I think you understand it, the need to go there. And you may, that's an assignment, just listening to you, I think you're up for it.
Well, I have to say, we have some things going for us in dealing with CMS. Several years ago, when they tried to cap family care, several of people in our congressional delegation at various levels got very involved. And so we have people like Tammy Baldwin, who is always willing to make the call to CMS to follow up. And we have several members of our congressional delegation who are willing to do that. The other thing is AARP. You know, the wonderful thing about belonging to a national organization is, even though I'm a bit of a pot stirrer for the AARP brand, on a national level, they do have a relationship with people in CMS because they have a regular ongoing relationship. And I can usually, at least on these issues, get comments put in that have a little more force than just me. And I think that we can influence CMS. I would prefer not to have a CMS fight because I can't get in their faces personally because they're too far away. I prefer to fight with people I can actually see and intimidate a little. And so I'd prefer that if we could nip this in the bud in Wisconsin, it would be much happier. But if we have to fight at the CMS level, I think we have resources between our national organization, the national organizations of the disability rights groups, and the advocacy community, and I think we'd do it.
Any questions from council members or from the audience? Hell, lady, you're hard to follow up. You're hard to follow.
Well, I love being last, too, thanks.
They got their marching orders. They don't even.
Really? I want to thank the panel. I want to clone a lot of you, take you around the country, because there are a lot of folks across the country who don't have a lot of what you have had in this state, don't have the organizational skill or expertise or history of working together that a lot of you have. So, final remarks, Ellen?
Just, I wanted to thank everybody who assisted me in putting this event together. The stakeholders, as Gary said, were amazing to work with. The team, the planning team that assisted me.
You said they were not shy.
No, they were not shy, and that was good. And I think we have a lot to consider as we move forward, as NCD moves forward in terms of its final report on Medicaid managed care and these forums. This is our 10th one and probably our last one. So we will be producing a report of the forums, as well as recommendations that we would forward to CMS, Congress, and the states.
And we anticipate meeting with CMS September, October, and I think we're very informed from this meeting today in terms of our conversations with CMS. So again, Clyde, any comments? Camila?
Keep it going.
Thank you all.
Thank you.